In this video I will show you how to wash your vagina. Maintaining vaginal hygiene is a crucial aspect of a woman's overall health and well-being. The vagina is a delicate part of the female body that requires careful attention to stay clean, healthy, and balanced. This comprehensive guide aims to provide you with detailed, practical, and helpful advice on how to wash your vagina effectively, while also debunking common myths and misconceptions. Understanding the vagina, a brief overview. Before diving into the specifics of vaginal hygiene, it's important to understand the anatomy and natural functions of the vagina. The vagina is a self-cleaning organ, which means it produces natural secretions, known as vaginal discharge, that help to keep it clean and maintain a healthy pH balance. This natural process is essential for preventing infections and maintaining overall vaginal health. The do's and don'ts of vaginal hygiene. Do use mild, unscented soap. Opt for mild, unscented soaps to wash the vulva, the external part of the vagina. Fragrance products can disrupt the natural pH balance and lead to irritation or infections. Don't use douches. Douching can disrupt the natural balance of bacteria and increase the risk of vaginal infections. The vagina is self-cleaning and does not require internal washing. Do wash regularly. Gently wash the vulva with warm water daily. During menstruation, you may need to wash more frequently to feel fresh and clean. Don't overwash. Overwashing, especially inside the vagina, can lead to dryness and irritation. The vagina's internal cleaning system is efficient and does not require extensive cleaning. To wear breathable underwear. Cotton underwear allows the area to breathe, reducing the risk of moisture buildup and infections. Don't use harsh products. Avoid products with harsh chemicals, fragrances, or dyes, as they can irritate the sensitive skin around the vagina. Best practices for vaginal hygiene. During your period, change your sanitary products regularly and consider using unscented products to minimize irritation. After using the toilet, always wipe from front to back to prevent bacteria from the anus from spreading to the vagina. During and after sex, urinate after intercourse to flush out bacteria and consider gently washing the vulva. In the shower, gently clean the vulva with your hand or a soft washcloth. Avoid using sponges or loofahs, as they can harbor bacteria. Addressing common vaginal hygiene concerns. Vaginal odor. A mild odor is normal. However, a strong, fishy odor may indicate an infection and warrants a visit to your healthcare provider. Discharge. Normal discharge is clear or white. Yellow, green, or gray discharge, especially if accompanied by a foul odor, itching, or burning, should be evaluated by a healthcare professional. Itching and irritation. These can be caused by a variety of factors, including yeast infections, bacterial vaginosis, or allergic reactions to products. Myths and facts about vaginal hygiene. Myth: the vagina needs special products for cleaning. Fact: the vagina is self-cleaning. Gentle washing of the vulva with mild soap and water is sufficient. Myth: wearing tight clothing is harmless. Fact: tight clothing can cause moisture buildup, leading to infections. Opt for loose-fitting, breathable fabrics. Frequently asked questions. How often should I wash my vagina? Wash the vulva daily with warm water and mild soap. Avoid washing the internal vagina. Is it safe to use scented products for vaginal hygiene? It's best to avoid scented products as they can disrupt the pH balance and lead to irritation or infections. Can douching help keep my vagina clean? Douching is not recommended as it disrupts the natural balance of bacteria and can increase the risk of infection. Final thoughts. In summary, maintaining vaginal hygiene is about understanding the balance and natural functions of the vagina. Use mild, unscented soap for the vulva and avoid internal washing. Wear breathable underwear, and steer clear of harsh chemicals and fragrances. Remember, the vagina is self-cleaning, and simple, gentle care is often all that's needed. By following these guidelines, you can maintain a healthy and balanced vaginal environment. Final tips. Stay informed and consult with a healthcare provider if you have concerns about vaginal health. Pay attention to your body's signals and seek medical advice if you notice unusual symptoms. Embrace your body's natural functions and remember that vaginal health is a key part of your overall well-being. If you enjoyed watching this video, then don't forget to hit the like button and subscribe.